Thank you very much, Mr. Chairman. Let me join Dr. Burgess and Dr. Cardenas as a lawyer who believes that physician-owned hospitals is probably not a bad idea and probably a good idea, particularly since in my hometown we have the Lewis Gale Hospital, now owned by a larger corporation, but started out many, many years ago by Drs. Lewis and Drs. Gale, and then revived in my childhood by doctors that I knew. They were physician-owned hospitals, and there's a lot of communities in my area that would not have a hospital today if it hadn't been for physicians a long time ago. And for many years, I owned my own law practice, and I drove down the costs of various items, particularly wills and representation in small traffic cases, because I liked helping people, and I think doctors can do the same kind of stuff. That being said, let me get you all to put on your common sense hats, take off your professional hats for just a second, and I'm going to start with Ms. Martin. We're going to go down to a yes or no. Am I correct that it's probably cheaper to treat a person with cancer if we catch it in stage 1 or 2 versus stage 3 or 4? Yes or no?
Yes.
Dr. Ippolito?
Potentially, yes.
Yes. Mr. Lyons?
Yes.
Dr. White?
It depends.
It depends.
That's a CBO answer.
Well, I know, but this is where I was going. And I didn't want to just pick on you.
Go for it.
But I have a problem with the way CBO scores things. And we have a bill in front of the House right now. It's in the process, HR 2407, which was an idea that Mr. Hudson came up with, and Mr. Arrington and Ms. Sewell are carrying. It's a bipartisan bill. And it says we're gonna say you're gonna pay for the multi-cancer test that you can get, and that's about $1,000 now. But we can pick up early stage cancers in 50 different types of cancers. Now, it doesn't tell you, you've got cancer A or cancer B, but this test will tell you, you have some kind of cancer, and we can narrow it down for you, but you better go see somebody to check it out. And to me, this would save us money. Now, I know it's not the formulas that you all use, Dr. White, but can't you see there's some advantage? And what do we need to do as Congress to give you the formula that would allow you to see that there's actually a cost savings? Taking the test is going to cost money. But in the long term, if 10% of the people that we paid to have a test done this year found they had a stage 1 cancer, it's going to save us every bit of that money in the long term. So, A, do you agree with me? B, is there some way we can change the formulas that you all use or give you the authority to look at where the cost savings would be?
Sure, and I appreciate the question. So first, let me say CBO in late 2020 put out a report on how we score prevention, and the multi-cancer early detection is a nice example of the types of prevention policies that we've written up and analyzed. And one of the key landmark studies that we cite in that comes from a group at Tufts that has looked at literally hundreds of studies on prevention.
So you see some advantages, because my time's running out, you see some advantages with that kind of a preventive tool, and you're willing to work with us to figure out how we can make that most effective for the people of the United States, because that will lower costs.
We're very open to hearing from.
Next question, not prevention, but just using practical CBO scoring. I've always had this issue with ambulance rides. So I'm a big proponent of telemedicine. And while telemedicine won't solve everything, I represent a very rural district. And if we have somebody who has to go see the doctor, it could be done by telemedicine, you might have a 40-mile, that translates, by the way, because the roads are windy and mountainous, that translates into an hour to an hour and a half ambulance ride to go see the doctor when you could do it by telemedicine. Help me figure out that formula so that you all can give credit when we know that we're going to reduce the number of ambulance trips that would allow us to do telemedicine in certain cases. It's not going to be appropriate in all cases. That too would lower costs if we were able to calculate that, would it not? Yes or no?
We have a team working on telehealth, looking, and what you're saying about ambulance rides being avoided, that's the kind of thing that we're looking at. We're building our own evidence base, and happy to hear any.
No, I appreciate that, because
evidence you have.
You can't just look at the flat land sections of the country and come up with a model, because it's not going to save as much money in a big city. It's not going to save as much money in the flatlands. But when I have a mayor of one of my towns has told me that he will drive to Abingdon instead of going to the town closest to him for medical stuff because it's an hour over the mountain to get to the next. Now, on a map, it looks like it's, just this far, and Abingdon looks like it's this far, a lot further. But there's a good road and it's flat, or it's less flat, or less mountains. So he goes the other direction. When I've had that happen, and I know that makes a difference, those ambulance rides are doing the same thing, and they're costing us a bunch of money.
Thanks, Mr.
I appreciate it. I yield back.